So I'd like to call the meeting to order, the meeting of the Board of Health on December 1st. We do have some technical difficulties tonight, so per our policies, we will not be able to have the virtual part of the meeting, but we will continue this meeting in person. And the meeting is being recorded so people can catch up with this meeting afterwards. So I'm calling the meeting to order, and I'm asking people to introduce themselves. Gary, do you want to start?
Gary Rosen, member of the Board of Health.
Michael Parado, member of the Board of Health.
Leopoldo Negron Cruz, member of the Board of Health.
And I'm Frances Anthes, I'm chair of the Board of Health. We're now going to go around, and for the people who are in their room, will be able to introduce themselves.
Dr. Michael Hirsch, Medical Director, Division of Public Health.
Kyle O'Connor, Tobacco Prevention Specialist, City of Worcester Division of Public Health.
And our guests.
Hassan Dambele, I'm with Yadco Energy.
Kieran O'Donovan with Yadco Energy.
Thank you all very much. We're going to look fairly quickly at the minutes of the last meeting. So they came out to us, and I would just make one correction. Maybe it's two. On page 6, the very first paragraph, it says, following the retailer's statement, the chair invited questions from board members. That paragraph is actually there twice. So I would say we need to omit the first time that it's there and keep the second paragraph. And then I would also, on that same page at the bottom, I think we need to add one further piece of information. It says the chair noted that staff would follow up with the retailer regarding next steps and encourage the business to ensure full compliance with all regulations to prevent further violations. I would like to add which would carry additional penalties. I know we said that, and I think it's probably important to have that in the minutes. Are there any other additions or corrections to the minutes?
Madam Chair, who writes the minutes? Is that Brenda?
Brenda.
I mean, she does a terrific job.
She does.
Actually, I mean, wow, this is the longest minutes I've ever seen for any meeting. So, I mean, I hope she knows that she doesn't have to record everything that's said, though. They're great, but it seems like it's a big undertaking.
Well, I think that what we're trying to, we did try to make them a little bit shorter, but then they weren't always as clear. So I think we're back to longer minutes that are, but I will talk with her about that, Gary. Thank you very much.
Motion to approve those minutes, Madam Chair?
Thank you. Is there a second?
Second.
Thank you, Michael. All in favor? Gary?
Gary Rosen, yes.
Michael Parado, yes.
Leo Negron Cruz, yes.
And Frances Anthes, yes. So the minutes are approved.
Thank you, Madam Chair. So today we're here to discuss a first state violation, a sale of a tobacco product to a minor at the business of Yankee Gas and Market, also known as Yadco Energy, at 67 West Boylston Street in Worcester. On October 29th, 2025, the Worcester Division of Public Health conducted a youth tobacco compliance check as part of the citywide tobacco enforcement program. During this operation, I observed the sale of a pack of Zyn Chill nicotine pouches to a youth under the age of 21 at this location. The clerk asked for the youth's ID, and when the youth stated that they did not have it, the clerk still proceeded with the sale. This sale constitutes a violation of Mass General Law, Chapter 270, Section 6, which prohibits the sale of tobacco products to individuals under the age of 21. Retailers are required to verify the purchaser's age through valid government-issued photo ID. The business was notified of the violation in person and over the phone the same week and issued a $1,000 citation for this offense, consistent with the state penalty schedule for a first violation within a 36-month period. Violation history, it's important to note that this is the establishment's first violation, and the applicable regulations, it's 105 CMR 665. The first sale of a tobacco product to a minor shall result in the retail establishment being prohibited from selling tobacco products for up to 30 consecutive business days. It also states that a first violation, a fine of $1,000 shall be imposed. The notice of the hearing, the retailer formally requested a hearing with the Worcester Board of Health on November 3rd. The retailer was contacted via email on November 21st and confirmed again over the phone on November 25th that the Worcester Board of Health will be holding this hearing during this meeting. The purpose of this hearing is to allow the retailer an opportunity to be heard before the board votes on the proposed suspension. And for our recommendation, according to the precedent set by this board in the July of 2022 and June 2023 meetings, a first offense for selling to a minor results in an automatic 5-day permit suspension, in addition to the $1,000 citation. So in accordance with state law and the Worcester Board of Health, we recommend that the Worcester Board of Health upholds the required sanction for a first violation, which is a 5-day suspension of the retailer's tobacco permit, as well as the $1,000 fine, but that's handled through housing court. So we're just here to talk about the suspension day. And I can answer any other questions.
Good evening. I think you probably are aware from talking with Kyle what the violation is alleged to be. And I think you probably also are aware that this Board of Health kind of takes the health of minors very seriously. And so there are pretty strict regulations, and non-compliance puts you in a place where you're here facing both a fine and a suspension.
We're aware, Madam Chair. Is it okay if I read a statement to the board?
Yes. Yep.
So my name is Kieran O'Donovan, and I serve as Director of Retail Operations for Yatco. Thank you for meeting with us tonight. I want to begin by acknowledging the violation occurred at this location. In this case, the employee intentionally overrode the ID verification prompt and disregarded our policy requiring both a scan and a visual match. That employee is no longer with our company. This is the first violation ever at this location, and it is one of our legacy stores. It has been in our portfolio for a long time, and it has always maintained a strong compliance history. Even though we're a smaller operator, we have firm controls in place, mandatory ID scanning for every tobacco sale, all required signage posted, weekly company-wide reminders, and consistent coaching from our managers. This incident was the result of a single employee choosing not to follow established procedure, not a breakdown in policy or oversight. Since the incident, we have recoached the entire staff, reinforced compliance expectations across all of our locations, and begun the process of implementing a formal online training program so every employee will have the structured, documented compliance training moving forward. We take this matter extremely seriously. Our goal tonight is to demonstrate that we acted immediately and that this was an isolated failure in an otherwise strong performing location, and we are committed to strengthening our compliance program even further. Based on our history and the corrective actions we've taken, we respectfully request the board consider forgiving or mitigating the suspension.
Questions from members of the board? Leo, do you want to go first? Okay. Michael?
Madam Chair, so this is through the chair to Mr. O'Connor. Is this the first time at this location that you've had a violation?
Yes, it is.
Okay. And you've now taken corrective action where you're providing an online training program for all your employees at all your
the employees
locations?
of the company, we're putting that process together.
Yeah.
We're going to be working with some third parties to possibly with WeCard, that program, to institute that company-wide. We're in the process of working on that. The employee involved was terminated. So we do take it very seriously across all of our locations.
Through the chair, how many locations do you have in Worcester?
19. We're about to open another one next week in Webster, Massachusetts. So we'll be at 19 by the end of the year.
And this is out of the 19 locations, this is the first time you've...
in Worcester we have what? Five.
Five. Okay. Hold on. Oh, you have 5 locations in Worcester, but 19 overall within
correct,
the corporation.
Yes.
Okay.
Mm-hmm.
Madam Chair, through maybe you can answer this question for me, or gentleman over here, Kyle could. I was not on the board in 22 and 23 when the regulations were passed. So is it by law that we have to provide a suspension, or do we have the flexibility if we do not want to do a suspension and just do the fine?
My understanding, and I'm going to look to Kyle for some help with this, one of the things we found out in our last couple of months of looking at the regulations is, and you may remember the attorney came in and talked to us about this last month, we do not have any ability at this point in time to suspend the regulations that are written, so that we do not have, we thought we did, but we learned from the attorney that we do not at this point have any ability to not enforce the regulations as
No,
they're
but
written.
my question is that do you have to enforce both the fine and the suspension, or can you just do the fine and no suspension?
At this point in time, we have to enforce, as the regulations read, both.
And so,
Kyle, do you want to
can you
answer
address
this?
the regulation, please?
Yes, so in that report that was submitted as part of the packet, I took this from the state law. So the state law says the first sale of a tobacco product to a minor shall result, not may, shall, in the retail establishment being prohibited from selling a tobacco product for up to 30 days. So that is what the state law says. And then in your 2022 and 2023 meetings, you establish that as a board, the first violation would be 5 days. You can go up to 30 days. Municipalities have that ability to choose that. But the Worcester Board of Health decided on a 5-day suspension. And that's the structure I was following for the other first offenses. There have been 9 retailers that have received an automatic 5-day suspension this year alone for the sale to the minor. So
what you just said to me is that we could go up to 30 days on the suspension, and the precedent of this board has been to go to 5 days. Is that correct?
correct.
Is there any precedent where you could go to 1 or 2 days?
That would be up to the board.
Would we have that opportunity to do that under the law?
Yes.
Currently, we could change it?
Currently, it says up to 30 days. So it says you shall enforce a suspension up to 30 days.
Right, and our current regulations, which talk about 5 days for the first violation, my understanding was we could not make an exception to that as the regulations currently read. Is that accurate?
So in our local regulations, there's no suspension structure outlined, which is why we're reviewing them and hopefully putting forth a more solid structure plan. So we revert to the state penalty structure, which is what I just read. So you have up to 30 days, or as it says here, the board could vote for a longer term enacted, but I'm just reading the
So I guess through the chair the precedent has been 5 days, okay?
Yes.
But it's under the state regulations, it says up to 30, correct?
Correct.
Okay, so if we wanted to do a 2-day suspension, we could do that if we chose to do that.
You could, as a board, decide to do that, yes.
And that, if we did a 2-day suspension, that might mean that people who had already gotten the 5-day suspensions would be back in front of us?
No, the board voted on that, so those are done deals, but I'm worried about equality and fairness for all
Right.
retailers.
So,
Any
Madam
other questions?
Yeah, I'm going to be making a motion, Madam Chair. Would you like the motion now, or you're going to wait till the rest of the board here?
Why don't we let Gary get a chance to ask any questions or discussion?
Are the gentlemen done with their making the case?
Yes.
A few things, Madam Chair. Just looking at the subject title here, first state violation. Why doesn't it say city violation also, Pat? It is a city violation, am I right?
Yes, it is.
So how come it doesn't say that also?
So the local policies we're currently looking at updating. So there's no penalty structure outlined in the local policies. So it's a state law. So we revert to the state law suspension structure and fine structure.
Well, I thought the penalty was 5 days, you said, and that's a city.
It is. It's the precedent set by this board. However, anytime a retailer has a violation, they can request to go before the board to discuss that penalty structure or to ask for leniency. So that's why we're here today.
Okay, because I was going to ask you if the first offense, as this is, comes with $1,000 fine, and we haven't heard, has that been paid, Cal?
I don't believe so. I think they are contesting it with the housing court.
Okay, and the retailer is fined with the $1,000 fine?
Yes.
Okay, so if the fine is given, which it is, and the suspension is 5 days, that kind of seems like you're hinting at, well, it's your policy 5 days, then why have anyone come in front of this board?
Initially, I tell all retailers when I serve them the fine and citation and let them know that a first violation constitutes an automatic 5-day suspension. On the bottom of each citation that I give out, it has the option to contest the fine. The fine is contested through the housing court, but the suspension is contested through the Worcester Board of Health. So at any point, the retailer can request a hearing with the Worcester Board of Health to discuss a
Right,
violation.
a hearing that they couldn't possibly win, is that right?
Yes, I think so.
Okay, we obviously have to take a look at our rules and so on.
That's why the whole regulations are under review
Yeah.
at this very moment.
Right, well,
We
we
didn't-
can't spend the next few months reviewing them either. You know, it's going to be done soon. I was under the impression that the rules we've set, and we talked about it when it was the smoking bar. I thought it was for that, those rules. You're telling me it's for every violation of our tobacco policy?
Any state law violation. So state law constitutes a sale to the minor, sale of flavored products. Local policies that would be under the Worcester Board of Health alone would be things like cigar pricing minimums.
And you mentioned that there was 7 or 8 we've had this year, first violations, and they've all had a $1,000 fine and a 5-day suspension.
Correct.
All of them, okay? But you would agree with me that each case we talked about, they're all different.
Yes.
They're not identical. Now, you mentioned Kyle O'Connor directly observed the sale of this Zyn Chill nicotine pouch to a youth. So you go in the store with the youth?
No, the youth goes in by themselves. They purchase the product. I'm sitting in my car right outside the store to make sure that they're safe and.
So you don't really directly observe the sale?
I guess not, but they bring out the product
Right.
and then we label it and we take a
Yeah,
picture
you
of
can
everything.
you verify the sale perhaps, but
Yes.
you don't actually say, I just want to, be clear that maybe, we should say what exactly happened, because I thought, well, you must have gone in and watched and you were standing next to the youth, and obviously you weren't. Now, maybe this is for Mr. O'Connor. You mentioned that the clerk did override the scanning, what do we call it, the scanner, the ID scanner? Is that the right term? So the clerk override that. So if I went into the store to buy cigarettes, does the store first look at me and say, well, we know he's over 21? Or does everyone?
Everyone, you need to offer a license in order to allow the
Right.
point of sale to.
Right, so everyone has to, okay. So I go in, I'm gonna buy some cigarettes, I hand the clerk my license. The clerk puts the license into some type of scanner. If it's a fake license like some teenagers have, the scanner would pick that up?
Would pick it up.
Okay, that's good. So the license, they didn't have a license. They came in and said, we don't have a license, okay. So that should end the sale, that should end it, okay. How did the clerk override with the young man not having a license? How did the clerk override that?
So there's a facility with regard to the POS where there are some identifications like a military ID or a passport that does not work through the scanning system. So we do want to be able to take care of people that have a passport that are obviously of age. We can manually punch in that date of birth from the passport or the military ID.
Okay. The young man had neither of those.
Right, and the clerk overrode it with a fake date or, whatever.
So the clerk intentionally overrode it. Why would a clerk do that? Is there that much money in one pack of these?
There's no money.
There's no money.
So I don't know. Just to be nice to the person who's trying to. Seems to me it's absurd for any clerk to do that.
100%. It was gross violation that we
Okay.
handled immediately.
Okay, so the clerk was fired.
Correct.
Okay. I think that's good news. I like that. When we say, Kyle, that the rule is up to 30 consecutive business days, that means 30 at the most.
No, it also says, or for a longer term enacted, adopted, or promulgated in the rule, regulation, or other measures by the appropriate legally designated health authority of the city.
That's if we had made our own regulation.
Correct.
Okay, so up to 30 days could be 5 days, 4 days?
5 days was the precedent set by the board in
Right.
June 2022 and July of 2023.
So are you saying this board, by setting the precedent of 5 days, tied its hands, and we cannot say to any business right now, tonight, to this business, you're paying the fine, you know that's the penalty, and that goes into, do you know where that money goes, Cal?
No, not off the top of my head.
Okay, that money goes into the general fund, and I think that money, all these fines, 1,000, 2,000, even third offense, 5,000, should go into a fund maybe run by either the Board of Health or Department of Public Health for education against smoking. This goes into the general fund, which can be used for snow plowing tomorrow, can be used for the deficit at Polar Park, can be used for so many things. So that's another issue, but I don't think it should be going to the general fund. But that happens to be where it goes. The business doesn't care where it goes. They just know, oh, we got hit with a pretty significant fine. It's their first violation. It's a significant fine. Cal, I see, and maybe we disagree, but I see these hearings as making sure that each business, whether we penalize them or not, and we do penalize them, each business says to us, we are going to be compliant. We weren't. We fired the employee for doing something utterly stupid and against their policy, but we are going to be compliant because it's the right thing to do. That's the main thing, the right thing to do. You're fining us $1,000. Okay, we're going to pay that, but we're not going to pay $2,000 in the future or $5,000 in the future because it's never going to happen again. Would Mr. O'Connor agree with that? Not going to happen again, my colleagues. What we're here for is to make sure everyone who comes in front of us is compliant with the regulations in the future. Punishing them is important, and we've done that. But when a business comes in, and I know this would set a precedent, when a business comes in and says, it's not going to happen again. I mean, we fired that employee on the spot because she did something terrible. She did something stupid that was just made absolutely no sense. She is gone. She's not part of the business. What does that mean? The business is telling me they will be compliant from now on. They don't want $2,000 fine. They don't want $5,000 fine. They don't want to sell to minors. I don't see that. Now, if I'm told that we can't adjust our rules, I'm not so sure. I'm not so sure. You're telling me, and Colin, I'm not putting any blame on you, but you said to me, they've been invited in, they didn't have to come, they wanted to come. I can't believe we're holding hearings that my hands are tied. I shouldn't even be talking then. If they're going to come in and say we
you're
paid...
stopping?
What?
Does that mean you're stopping?
No, it doesn't mean I'm stopping.
Okay,
Thank you, ma'am.
just checking.
I'm just saying that if we're having a hearing and they're coming in front of us and you're telling them that they have the right to have a hearing, well, they don't have a right to hearing if my hands are tied. So I don't like that process, and I don't think it's right to have people come in front of us and tell us, you were pretty stupid to come in front of the Board of Health because they made a rule and they're never going to break it. They're never going to change it, even though we know that they're going to be compliant. And I shouldn't be talking to Carl. I'm talking to my colleagues on the Board of Health. They're going to be compliant. Isn't that the goal? Isn't that the goal? Madam Chair, Carl wasn't here. I don't think the other board members were here. You and I were here, maybe 3 years ago. Time passes fast. We had 15 people down here one night. Do you remember that hearing? There were about 15 people from different businesses. The place was packed, standing room only. Carl, you don't remember because you weren't here. About 3 years ago. I think they were all here for selling to minors. Am I right?
I don't remember the
Okay,
details.
well, I happen to remember. And they were all here, 15 businesses, the owners, the staff, and so on. We didn't have them all speak because there were so many of them, but we talked. And you know what? What the penalty was for each of the 15? You better not do it again. We're not going to fine you, and we're not going to even suspend you. You just and we all gave speeches. You remember that, Madam Chair. We all gave our speeches, and I tore into every single one of them, saying we don't want anyone selling to minors. I don't think any of them, maybe one, but certainly nearly all of them have never come back in front of this group. They are complying, and this business is saying we are going to comply too. I believe them. if we could do this, we could say this: we're not going to suspend your license for 5 days, but if you come back in the future for a second offense, then you're getting 10 days. The 5 days we could have given you, and the 5 days for the second offense. We give you 5, in other words, we give you 5 extra days from what that would be. But I don't think you're going to see them again. And does this set a precedent? If we do that, yes, it sets a precedent. But it's their first offense. And you know why. It wasn't his mistake, and it wasn't his mistake. It wasn't the owner's mistake. It was some staff member who got what she deserved, and that's that she was fired on the spot. So, Madam Chair, there's a motion on the floor not to go ahead with the suspension. You can tell me in 2 weeks or 2 months that, oh, what we did was wrong. I'm not so sure. We make the rules. We make the rules. There's a hearing tonight. I want to do what's right for the hearing. I don't want to go back a couple of years.
Okay, Gary, let's, I think it's now my turn to talk. So we know already as a board that we are in an unusual place because we've asked the department and the law department to relook at the regulations. And that, they said to us, would be back to us by February. So we are now in an unusual place. We don't really have the right to make new regulations. We're still under the aegis of the old regulations. And the old regulations, which we've been enforcing since 2022 and 2023, are that you have certain penalties for first violations, second violations, and third violations. In my experience, we have never had anyone come before us and say, well, I'm going to go out there and do it again or do another violation. Everyone who comes before us says they won't do it again. Now, I really appreciate that you've taken some very specific steps in terms of this business to make sure that it won't happen again. And you're probably on the top of the list in terms of people who've made very sincere, enforceable regulations for your business. But I don't think we have the right or the responsibility to change the regulations, breaking with the precedent, when we've already asked both the staff and the law department to help us make these work better. So I am not going to vote for this, and I don't believe it's kind of the time for this. We know this is a tricky issue. We know we need to come back to it. It does mean the people who get caught right now in violation of it are going to be operating under the old rules, and it acknowledges that there will be new rules. But if you're here now, it's because you've broken the current rules. And those were the ones that when you got the permit to sell tobacco, you agreed to abide by. And I don't think anybody disagrees with the fact that there was a violation here. So I think we have to go with our current regulations, what the staff has done, what their recommendation to us is. So I'm going to be voting against this.
Madam Chair?
Not yet, Gary. Is there anybody else who wants to speak before Gary talks again?
I'd like to speak.
Mike.
Thank you, Madam Chair. I just want to clarify, okay, one more time for everybody that's sitting, including my board members, okay, is that we don't have to go to 5 days. If there was a motion on the floor for a one-day suspension, okay, that is not violating the regulation, correct?
Correct.
Okay. Madam Chair, I'd like to amend Mr. Rosen's motion.
It's your motion.
Okay.
Didn't you make the motion first?
Sure. I didn't. I waited.
Oh, okay. You waited for
made
Gary.
the
I'm
motion.
sorry. That's
so
me
what
not
I'm going to
following.
do is,
Okay.
14 years worth, okay?
Sorry.
All right. I'm going to amend Gary's motion because I want to follow the law, and I do want to send a message, and they are paying $1,000 for a one-day suspension instead of a 5-day suspension. And I make that in the form of a motion. Thank you, Madam Chair.
Okay, so you're trying to amend Gary's motion. Gary, have you accepted the amendment?
The amendment was to have a one-day suspension. Okay, as much as I think there should be a no suspension, I'll go along with the 1 day.
Okay, and did you want to speak to this motion, Gary, or did you have anything else that you seemed to indicate you wanted to say something else?
Yes, I do. Thank you, Madam Chair. First of all, we talk about some new rules coming. Who votes and accepts those rules? Who does that?
This board will accept the new regulations after they've been through the staff process and the law department process, just as we did in 2022 and
But we do have the
2023.
right tonight to make a rule. Like we always have that right. We can make that rule tonight.
My understanding from my meeting with the city manager and from what the law department said when they were here, and somebody can correct me, Kyle, maybe I'm wrong on this, is that we may not grant variances to our regulations.
Until we
at this
change
time.
the rules
Until we
tonight.
change the rules. I don't know that we can change the rules tonight.
What? Why? The law department is only giving us advice. They're not voting. This is the body that makes the rules. We don't have to wait for January or February. We can do it tonight. We can eliminate the 5-day
Well,
automatic required suspension.
We have put before this board with agreement that we wanted to have the staff take time to look at what the regulations are, to look at what the glitches in the regulations were, and to have it reviewed in the law department. Now, I suppose we could vote on anything we want. That doesn't mean that that's the process that we've agreed to. Kyle, do you want to say something?
Any changes to regulations, I believe, has to go through a public hearing process so the public can weigh in. So
Well, you have to make the change first. You vote on the change, and then there's a public hearing.
no, I believe it's public hearing and then you vote. I would have to check though.
No, we'd have to come up with the change anyway. I mean, obviously for a public hearing. Okay, so that was my thought. Now, again, I want to stress that we want compliance from this business and every business. There's a $1,000 fine that's been accepted. They had no choice anyway, so it had to be accepted. Right now, we're talking of a 5-day suspension unless it's Mr. Prado's amendment to my motion passes. Why does a 5-day or even a 1-day suspension make them want to comply anymore? Do we have some doubt that they won't comply and, we hit them with 5 days or even 1 day, now they're going to comply? That to me doesn't make a lot of sense. They might comply without the 5 days or 4 days or 3 days or 1 day or maybe even 0. That's what I'm saying. I don't know. Maybe we should have 3 penalties. We got fine. We got 5 days off. Maybe there should be something else. We want them to comply. That's the key. That's why we're here. We want them to comply. I know others. No one comes down and says, I'm not going to comply. I'm going to comply. They fired the staff member who did something we just heard really stupid. They fired her on the spot. What more do we need? Doesn't that show when they found out right away, oh my God, this is not us. This is not the way we run the business. We always have complied because it's only our first violation. We always comply and will continue to comply. And 5 days or 4 days or the 1 day, isn't it going to make a difference because they are going to comply anyway? So I support, I'd still prefer, but Mr. Parado felt that 1 day would be better than no days. I will support his motion.
Okay, we have a motion on the board, and the motion has been seconded. I'm going to ask for people to vote on it, your name and your vote. Gary?
Gary Rosen, yes.
Francis Anthes, no.
Michael Parado, yes.
Leo Negron Cruz, no.
So the motion fails to carry. We still have in front of us the meeting for the hearing today. So I'm looking for a motion on the recommendation or a different motion if that's what someone wants to make.
I can just answer Gary's question that was a few statements ago, but the reason why we do suspensions is because a lot of convenience stores, gas stations, they generate a good amount of revenue from the sale of tobacco and nicotine products. So a suspension of their permit for however many days acts as an incentive for the retailer to not have any violations further.
Madam Chair, may I ask, what would this cost? What will this cost the business? This 5-day suspension? $10,000 at this particular location in sales. I mean,
mentioned extra people come into your store if they can't get their cigarette, they'll go somewhere else to get their coffee, they'll go somewhere else to get.
and they might stay somewhere else too. They may not come back.
There's
Okay.
Yeah, I
Is
just think,
there-
Madam Chair, you know, we are making a mistake because we've got a business here that is willing to comply. They've shown that. They've shown us. Now, I don't support the 5 days, obviously, but by turning down by turning down Mr. Parato's motion, his amendment to my motion, you still haven't enforced 5 days. You didn't vote for that.
No, we need a motion to accept the recommendation of the Worcester Board of Health on the sanctions.
Can I make a second motion before we do that, Madam Chair?
As I understand it, anybody here can make a motion except me, so yes.
Madam Chair, what I'd like to do is a recommendation of a 2-day suspension. I make that in the form of a motion.
Okay, is there a second for a 2-day suspension?
Madam,
Is that a second?
before, I have to ask them a question before I do that.
Okay.
Madam Chair, so we expect probably within 2 months from the law department, at least, and our staff, some recommendations for some new rules. I think we agree on that. Probably within 2 months, maybe even sooner. Am I correct?
Yes.
Soon enough. Could we do this? The recommendations that come from the law department and our staff might be that we do a suspension for this company. Can we put this on hold, not suspend them now, and then when the new rules come and we vote them, then maybe we say, oh, with our new rules now, we don't have to suspend them. Right now, we think we do. Okay, and that's what the vote has been so far. But can we put it on hold, say, keep the business open, we'll have new rules hopefully by February, and then they can come back in front of us and we can talk about it again. But it's just delaying it because I don't know what the new rules are, and Madam Chair said we can't do the new rules tonight until we hear from our staff and from the law department. Okay, fine. So I don't know what the new rules are, so maybe with the new rules, we won't be giving them a suspension at all. So can we delay that and keep them open now and maybe enforce whatever suspension is going to be in the future? And I would make that in the form of a motion.
Yes,
Make that in the form of
there's another motion on the floor already.
No, I'm going to make a motion. I have a question by Kyle of you. Does our regulation include a penalty, or this, because this penalty comes from the state law, and
Correct.
not necessarily for a city regulation?
So because the city regulation is kind of in a weird spot right now, we always have the option to refer to state law because state law supersedes any city law. So whenever there is a sale to a minor or sale of a flavored product, I almost always refer to the state law and penalty structure because that's what all municipalities in Massachusetts follow.
And that state law is up to 30 days?
Yes.
So that could be 0 to 30.
You can read it here. It's the first sale of a tobacco product to a minor shall result, not may, shall result in the retail establishment being prohibited from selling tobacco products up to 30 consecutive business days.
Yeah, it should say from 1 to 30 days then.
Right.
But it doesn't say that.
I'm just
So
reading the state
up to
law.
30, anything less than 30 at the most, anything less is good, 0 is good.
You could do
Madam
more
Chair,
than
can
30 days as well.
Can we delay this then until the new rules? And I won't be on the Board of Health then anyway, but maybe the 5 people hopefully will be on. We'll take another look at this and say, yeah, we didn't enforce it then, but we better enforce it now because the new rules are even stronger. I don't know what the new rules are. So maybe we can delay this because we know they're going to comply. I'm guaranteeing you they're going to comply. They fired the person who did this.
Gary, other people have been here before saying they fired the person who's in this. How is
Oh,
this
the
different?
stories were much different in the past, much different. I was out in Syria, my grandmother was dying, and there was my brother who was running the business. Each business in each case is unique, They are going to accept the fine, and they are going to comply. Isn't that our purpose? We have a business that's
Okay,
going to comply.
I think you're the person who wanted a short meeting tonight, and you haven't stopped talking since.
Yeah,
So,
well, because that's
let's-
my job, and that's my
Okay, so
responsibility.
let's just clarify what we have we have one motion on the table without a second. I think that you're trying to put a different motion on the table.
I am. I was hoping Michael Prado would withdraw withdraw his temporary.
All right, Madam Chair, what I'm going to do is I'm going to withdraw my motion, and I'm going to make a motion to hold the item, hold items, hold precedent.
So that's, let them stay open, Madam Chair, until we have the new rules, and then we take another look at their penalty.
Kyle, as the staff person in the room, is there any precedence for us holding an item with a suspension involved?
No, the state recommends that all penalties, especially with the sale of the minor, the enforcement should be done as soon as possible.
That's what my understanding is.
Yes, and I would also clarify that the new rules, the new regulations would follow the same structure. The 5-day
Could
penalty.
you please repeat that again?
So I can't really speak to the regulations because you're the body that decides
Right.
and votes on them. So the recommendation that would be brought forth to you, I assume, would be a first violation of a sale to the minor would still be the $1,000 fine and 5-day suspension. So it's not like come the new rules, it would be anything different. I'm not the person
We
that
could
makes
vote
the rules.
against it, but you're saying that is likely to be what the staff will be recommending. You're not expecting a big change. It seems to me the reason why we're looking at the regulations is about if there's any ability for this board to waive, which we right now don't have, and if we want to delineate between retail establishments and smoking bars. That, I think, is what is most likely to come back to us from my understanding, and it sounds like you're agreeing with that. Is that?
Yes, that's the main focus of the update.
Okay. Okay, so now there's a motion on the floor. Do you want to repeat the motion, or is everybody aware?
Madam Chair, under Robert's rules, a motion to hold the item is held, okay? I don't care if it's with the city or not, but that's when an item is held, okay, it's delayed until we bring it up again.
That I am not clear about. I will.
I'm very clear about it.
I will-
was the chair of
okay.
the Rules Committee for many,
Okay,
many years.
I will.
okay?
I will
Madam-
take your word on it, but I do ask the staff who are present to check that one for me with the law department because
Yeah.
I need some. Clarification on that, and I'm sorry not to know.
Which is
that.
another good reason to hold it. But Madam Chair, none of us can anticipate these new rules. I mean, whether it's the staff.
Gary, I have not called on you. Let me be very clear. I have not called on you right now. Okay, so we're going to assume that Michael Parado has the right rule here in terms of Robert's rules, and that his calling for a hold. Are you saying we don't even vote on it?
Correct.
You just call it
Yeah,
for a hold?
Until we get clarification on a report on it.
Okay. Okay, so we won't do anything else with that item tonight. I think we can have staff invite you back either next meeting, or if there's a hold that this is correct, maybe it will hold until after we have the new rules. Okay, sorry about that, to have you come out for that. And thank you for the work that you're doing to make sure it doesn't happen again. I appreciate that.
Thank you for your time.
Okay, Dr. Hirsch. Would you like to give a report?
Wow. I thought it was bad out there before this, but no.
Pardon me?
My report is very short.
Thank you, Kyle.
The COVID numbers, although they're lower than they were when we had our little mini spike in September, are trending up. And the really important numbers are going to be in the next few weeks when we see the results of the travel and gatherings, family gatherings, et cetera, where there's been a lot of indoor activity with folks that may not even realize that they have COVID. Similarly, for the flu, there is a variant of flu that is going around that, unfortunately, because of the oversight committee being disbanded by the CDC, that usually chooses which strains of flu they're going to attack with their flu vaccine. This flu vaccine that came out is only 40% effective in tackling the flu variant that's going around, which apparently is a pretty severe flu. If you have gotten the flu shot, it's not to say you shouldn't get a flu shot. You should get a flu shot. The flu shot does reduce the likelihood that you're going to end up being in an emergency room or hospitalized. So we're still recommending in both cases, COVID and flu, that you get a flu shot and a COVID shot this winter, fall going into winter. Bird flu so far has only affected the gentleman I spoke about last month who caught it out on the West Coast. It was a different variant of bird flu, H5N5 instead of H5N1. The only thing bird flu has done was drive up the cost of turkeys this year because so many flocks had to be destroyed because they were infected with bird flu. I think the last thing I'm just going to say is, Thanksgiving was a time when most of us treasure time together with our families. We talk about life, we talk about politics, we talk about kitchen table items, and I think it's particularly nefarious that on Thanksgiving weekend, the CDC issues a statement in their website and on their social media saying that COVID vaccine killed 10 children. This report was released without any backing of a peer-reviewed journal. It did not describe whether or not the children involved had concurrent illnesses. It didn't describe how old the children were. So that kind of fear factor injected into a Thanksgiving weekend where people are potentially going to say, well, I'm not going to get that. I'm not going to give that to my kid. We know that the COVID vaccine saved millions of lives and millions of children's lives. The United States lost 1.3 million people. Worcester itself lost 600 people. There would have been so many more had it not been for the development of the mRNA vaccines that saved so many. So I think the CDC and HHS has lost so much credibility now. All of the medical organizations were kind of asleep this weekend, and they kind of woke up Monday to what was released in every single network report that I saw today, and on several of the websites where doctors weigh in, were appalled at that timing of that release and the quality of the release. It's not based in science. It's based on an agenda that Robert F. Kennedy Jr. has. There was a report in the Atlantic that came out the day before this release by a very respectable journalist named Michael Shearer, kind of outlining the very bizarre biography of Robert F. Kennedy Jr. and how he got on this anti-science crusade. And it really is for him a crusade. He feels like he's going to save millions of lives by changing the way we eat, by changing the way that doctors treat patients, by changing the way that we approach health with better nutrition and exercise. And some of the stuff that he has advanced is not completely wrong. But most of the stuff that he advanced is just shooting from the hip because he has no scientific basis of advocating for them. It's just his gut that he's trying to push on us. I think it's a very dangerous time. It goes along with shooting people out of the water who are hanging on to a lifeboat. It goes along with a lot of other things the administration has decided to do. And it goes along with what I talked about the last several meetings, is that I think fear is the biggest worry I have in public health right now. And fear of vaccination should not be among them.
Thank you, Dr. Hirsch. Any comments, Leo? No. Michael?
Sad.
Gary?
Thank you, Madam Chair. Dr. Hirsch, any idea, maybe you said it, but I didn't hear it, any idea how we're doing in Worcester with the flu vaccine? Are we much lower percent now than we normally would have?
unfortunately, the estimates from the Mass Department of Public Health is that the flu vaccine percentage this year is barely 20% of the population, which is down at least by half.
That's terrible.
And the COVID vaccination is in the 20s as well. Nobody seems to be interested in getting boosters. There are a lot of people out there that feel like I had it once and I'm not going to get it again. Fortunately, even with this last surge we had in the fall, a lot of people did not end up in the ICU. But I think that what we're learning more and more about these viruses is that they're very smart about how they mutate. And it's a matter of time before we see one of those mutations take off.
So this new, is it called a new strain of the flu?
Yes.
Okay. Does that mean that the strains that are covered by the flu shot can't be around because there's a new strain, or could there be 3 and 2 of them are covered?
Yes, the latter.
The latter. Okay. So getting the flu shot would protect you against at least a few more common strains that maybe have been around for a while.
Yes, sir.
Okay. Thank you, Dr. Hirsch. Thank you for the report. Madam Chair, thank you.
Dr. Hirsch, I'd like to kind of come to the thought of a booster. So the flu, we've generally done 1 a year. And I think that's partially because of when the flu is most prevalent, as well as because we think it lasts for about a year. And COVID, we did many of them. We did many more. So what is the current thinking about boosters, either for flu or COVID? What should you get by next year?
I think a yearly flu shot is still the right frequency. The flu seems to have a pattern that is been reproducible, where it starts up in late October, kind of gets to a peak in mid-December to January, and then kind of gradually wears off in February and March. So that, I think, is a well-established pattern that we can rely on 1 a year. COVID has been different. COVID has had strains that have taken off in the summer, that have taken off in the spring, and have taken off in the fall. So we haven't been able to be as confident and say, oh, just get your 1 booster a year and you're done. I think that is why testing and scientific research, a lot of which the funding for has been eliminated by the CDC, is so important. We're never going to really be able to be as confident about saying you should get your 1 booster of COVID a year until we have the data, and we're not going to get the data with the kind of research funding that is available. I don't know really whether we're going to awake from this anti-vax fever in 3 years or not, or maybe in the midterms, I don't know. But until we get more data points, I can't tell you that getting your COVID vaccine booster in every September is the right thing or not.
So, as a public health department, if we were asked by one of the more vulnerable groups, which as I understand are people with diseases, immune diseases, people over 65?
Yes, 65.
Women, I know that's Massachusetts and not necessarily everybody. What would you be advising them in terms of, I've got less spring, should I get another one?
I think any of those high-risk category people should at least get 1 this fall, and probably then wait and see what comes of the next wave of COVID over the next calendar year. It may change. It may be that it's a very quiet year, or maybe a very virulent year. I can tell you, I wish Amelia was here, because she's been our point person for all kinds of vaccinations. And the vaccination clinic that she just ran in a barbershop, where we did a public health screening for men of color, essentially, Latino and African American men at a wonderful barbershop on 90 Madison Street called Francis Barbershop. She gave quite a few of these vaccines away because just in explaining to the folks that came in for their haircuts that it's a good idea to get a booster every year, they said, "Oh, I didn't know that." And that was a kind of a punch in the nose to me, because I think somehow we're getting the message out there, but we're obviously not reaching some of the more vulnerable populations. And all credit to her. She's been out there with we're not given a lot of vaccine anymore because it's only to be given to people that don't have insurance. And there are not that many of us in Massachusetts that don't have insurance anymore, but there are quite a few that are in some of the, yeah. I also should mention, I don't know if it's been out there very much, we've had a minor outbreak of Mpox, which used to be called monkeypox, but it's been condensed into Mpox. We haven't had one since 2023. In 2023, the strain of Mpox that took over a swath of population was mostly based on homosexual male sexual activity. And unfortunately, I think in the early days of the outbreak, the wisdom going into the messaging about it was implying that everybody could get Mpox. That wasn't true. So we had mothers bringing in their kids saying, "I'm worried about getting Mpox. Can you get a vaccination?" Whereas the gay male population wasn't hearing the right messaging. So finally, after a couple of months, the CDC relented and put that language into their warnings. And then with the help of AIDS Project Worcester, for us as a microcosm here in Worcester and across the country, the gay male population listened and got vaccinated. It's an interesting vaccination because you have to do it twice, one point A and then a month later. So you get a lot of protection from one, but you really need two to be 100% protected. This outbreak was caused through heterosexual spread, but it was spread in the homeless population and by sex workers in Worcester. So Amelia has spent the last week, and our whole department has been so busy with Tamara's help and Alex Arriaga and the Mass Department of Public Health, vaccinating folk in some shelters and in some encampments. And we've given away about 70 doses that we've gotten from the state. And we're hoping we have kept a lid on it, but you'll hear more from us if it ends up being more prolific than that. So I'm sorry that I didn't jump to that one.
And it's sexually transmitted?
Yeah. Intimate skin-to-skin contact is the politically correct. No, I'm just saying I think your description is better, but no, Madam Chair.
Okay, thank you. So now I think we come to the place where the other items on the agenda we can't do because we lost the virtual aspects of this meeting. Does anybody see that any differently or want to comment on that? I think the good thing is you've got the written documents in front of you, and we will add this to the next agenda. You can see that Tamara's done some work for us on some of the things that we've requested, and that report is here. And I think from looking at the minutes, that we also had thought that we were getting the training and workforce development group to do the presentation tonight, which is here, but Chelsea can't come into the meeting. And there was a question about the built environment for the next, so I don't know, I'll check with Tamara and Alex about whether that's too much for one meeting or not, but I think that those might be the agenda items for the next meeting. Any other items that people want to think about for the agenda?
Madam Chair, do you have a date in mind?
That would be my next thing.
Oh, sorry.
So it seems like we should be able to do the next meeting on the first Monday of the month, unless that's going to be problematic for people. It is past the holidays. It is January 5th. Does that work for folks?
It won't work for me.
It won't work for you. Then I'm going to put it off to a date that will work. And the reason why I say that is Gary will not be here because he's going on to the city council. So we would be a group of 3 unless the processes that the city manager is working on work through. So I did go to see him last week, week before, and say we really need some of the vacancies filled. I believe there are, I think, several folks that are through the initial parts of the process, like maybe 3. And then because Gary was leaving, he was getting other interest. So I think that I was really begging for at least one person by the January meeting. And he said he would try and do that. But there are several steps to this. So I don't think it's sure. Leo, if you're not going to be here, I would prefer then to move it to the 12th. Can people do it on the 12th? Okay. Okay. And again, we would definitely hope that
We have another member.
we have another member by then, and possibly 2. Okay, so we will go for the next meeting on January 12th. Before we leave, I would just like to wish Gary well as he continues his efforts of public service in the city of Worcester for the city council. And thank you for your service on this board.
Thank you, Madam Chair, and I've enjoyed the last 4 years, and pleasure working with you as the chair and my present colleagues and some of our past colleagues too. And I look forward to, as a city councilor, working with the Board of Health in the future, because we probably should strengthen the relationship, the Board of Health with the Worcester City Council, especially the Worcester City Council's Public Health Committee, which I may certainly be on, and I'd like to serve on that committee. So thank you very much to my colleagues. I appreciate it.
Okay, thank you. Any other items? If not, I'd be looking for a motion to adjourn.
Motion to adjourn, Madam Chair.
Okay, Mike, is there a second?
Second, Leo?
All in favor? Aye. Aye. Yes, thank you. We've got your, so we're going to do that at